Welcome to the video series on sweetest dreadful disease, diabetes. As the first part of this video series, in this video we are going to discuss about the history of diabetes. Most of the people think that this disease occurred in human beings might be around 100 to 150 years ago. However, that's not the truth. In 500 BC, Indian physicians identified this disorder and named it as Madhumeha. Madhumeha is a Sanskrit word which means sweet urine. They named this disorder as Madhumeha, sweet urine, because they observed ants gathering around the urine of this disorder affected person. Even though there is no clear evidence on who coined this term Madhumeha, the two great Indian physicians named Sushruta and Charka mentioned about this disorder in their manuscripts. In Egyptian manuscripts belonging to 1500 BC, physicians mentioned about this disorder as too great emptying of urine. So, they identified excessive urination as one of the symptoms of this disorder. In 150 AD, ancient Greek physician Aretaeus named this disorder as diabanian, which later evolved as diabetes. So, the word diabetes was evolved from the term diabanian, which was coined by Aretaeus. The actual meaning of diabetes is siphon, a tube which has opening on both the ends. This Greek physician compared the body of this disorder affected person with a tube which has opening on both the ends. He described this disorder as no essential part of the drink is absorbed by the body while great masses of flesh are liquefied into urine. What he meant to say is, if a person is affected with this disorder, the nourishment given to the body through food is not absorbed by the body and this food gets excreted through urine. At the same time, great masses of flesh, that means muscles and fat in the body, gets broken down and excreted through urine. By 18th century, physicians are able to identify the symptoms of this disorder. So what about the malfunctioning of the organ responsible for this disorder? This was revealed from the experiments conducted on dogs. In 1889, two German physicians, Joseph von Mehring and Oskar Minkowski, separated pancreas from the body of a dog and identified diabetic symptoms in that dog. With this experiment, they concluded that functioning of pancreas has some relation with the diabetes disorder. Almost after 30 years of this experiment, on the midnight of July 30, 1921, an intellectual experiment conducted by Canadian doctor Frederick Banting and American biomedical scientist Charles Best proved that lack of insulin leads to diabetic symptoms. Banting and Best removed pancreas from a dog when the dog was with elevated diabetic symptoms and almost on the verge of coma. They injected the extract obtained from removed pancreas. Within an hour, they observed the dog coming back to normal condition. Further experiments by Banting and Best proved that insulin present in the pancreatic extract lowers the diabetic symptoms. In 1922, Frederick Banting, along with Scottish biochemist John MacLeod, injected the insulin extracted from animals to a 14-year-old boy with diabetes. They observed decrease in diabetic symptoms in that boy. This created sensation in the diabetic history, and for this experiment, Banting and MacLeod were awarded with Nobel Prize. This 14-year-old boy, Leonard Thompson, is the first person to receive insulin treatment. From there on, physicians used it to treat diabetic patients with insulin extracted from animal pancreas. Human insulin and animal insulin differ in their chemical structure. However, there is no significant difference in the clinical outcome produced by these two hormones. In 1980, the first human insulin was manufactured. Insulin, which is now available in pharmacies, is the biosynthetic insulin which was first prepared in 1982. This insulin is prepared by applying recombinant DNA technology in bacteria and yeast. That means the gene responsible for the synthesis of human insulin is incorporated into bacterial DNA. By culturing this bacteria, they increase in number and the insulin produced by this bacteria is purified and stored. In 19th century, even though insulin therapy occupied a major portion in diabetes treatment, by 1850 non-insulin therapy was emerged out. Non-insulin therapy is the treatment of diabetes without injecting insulin. The anti-diabetic tablets and the capsules available in the pharmacies comes under non-insulin therapy. Now we have glucometers and other latest advanced technologies to estimate the blood and urine glucose levels. However, in 16th century, the most dedicated physician Thomas Willis used to identify the diabetes affected patient by directly tasting their urine. In 1960s, urine strips were used to estimate the level of glucose in urine. These strips are with a band of colors which upon inserting in urine, the change in colors gives the level of glucose in urine. Now, glucometers are widely used and the technology is developed in such a way that the equipment available in the market which records blood glucose levels every hour in a person without affecting his day-to-day activities. So far, this is a brief information on history of diabetes. The topic in our next video in this video series is understanding diabetes. With the information provided in the next video, we can clearly understand what is diabetes and what is happening in our body with each and every diabetic symptom. Thanks for watching this video. If you find the information we provided in this video is useful, please don't forget to like, share, comment and subscribe.